With the knee protocol that we have, the in-office treatment consists of several different treatment forms. And one of them is actually working on the muscles and tissues around the knee itself. Now, my preference is to do soft tissue work with a metal tool to really help work on the fascia, which is the tissue that's underneath the muscle, as well as any scar tissue that's developed. So maybe you've had surgery, maybe you have other reasons for scarring developing through here, but scar tissue is really limiting on range of motion and overall function of the knee. So when we do muscle work with a metal tool, we go along the lines that we want the knee to be moving. So we know the knee just bends back and forth. It's a hinge joint. So we want to make sure that all of our tissue lines are going in the same direction. So we do things like this to help break up any adhesions that can develop in these tissues. We'll do some on the side, through here as well. Any of these muscles that we feel need to be worked on in order to help this knee move better, we will do some of this soft tissue work with the in-office visits.